Hi everyone, Dr. Kofi here and welcome to another tutorial on TutorMed. And as you have come to realize, medicine is simplified here. And so the vibe is that you watch for 30 seconds, pause and have some time to like and share the video, and then subscribe to the channel if you have not done that yet. In the previous video, we got a basic understanding of the QRS complex. Now, we want to discuss the pathologies the QRS complex can show, and in this episode, we will discuss ventricular hypertrophies. Alright, so grab your notepads and let's get started. Very good, so let's begin with left ventricular hypertrophy. Before that, remember we've already established that when examining waves on the ECG, we get mad at them. So M for morphology, A for amplitude, and then D for duration. For ventricular hypertrophies, the component of the MAD which is of importance is the amplitude. Now for left ventricular hypertrophy, there are several ECG criteria. Perhaps you will be relieved to know that we won't discuss each one of them. We will discuss and apply only one. We will just mention the names of the rest so that if you are interested to know more, you look them up later. Now, most of these criteria are insensitive, meaning even when a patient has left ventricular hypertrophy, the criteria will not pick it up. However, they are fairly specific for left ventricular hypertrophy, meaning once they pick it up, the chances that the patient has left ventricular hypertrophy is very high or are very high. And this fairly good specificity is for middle-aged or older patients. For younger patients, the criteria is neither sensitive nor specific. So let's mention some of the criteria. The most common is the Sokolow-Lyon method, and that is what we will discuss and apply. The others include the Cornell voltage criteria, the Romhild-Estes point score system, the Roberts criteria, and then Scott's criteria. Very good. And so what does the Sokolow-Lyon criteria for left ventricular hypertrophy say? Let's illustrate this on this ECG report or reading. Here, I only showed the precordial leads because they are the least relevant in this criteria. And so back to the Sokolow-Lyon criteria. The criteria says focus on two leads, lead V1 and then lead V5. Some add all V6, but actually it is lead V1 and then lead V5. For lead V1, focus on the S wave, and this is the S wave as indicated by the arrow. And if you have watched the previous video, you understand why this is the S wave, right? Very good. And then for lead V5, focus on the R wave. And this is the R wave like I've indicated. Now the criteria says that the S wave in V1 plus the R wave in V5, if more than 35 millimeters or 35 small boxes, indicates left ventricular hypertrophy. And so let's apply this criteria on this ECG report. Now on this report, how deep is the S wave? How many boxes does it cover? We have 1 big box and 2, 3, 4. And you can even see that it has about two small boxes here, right? So remember that 1 big box is 5 millimeters, and so the 4 big boxes it's covered is 20 millimeters plus the 2 small boxes we indicated. So that gives us 22 millimeters. It means the S wave in V1 covers 22 millimeters. Then we move to lead V5. How many boxes does the R wave cover in lead V5? We have 1 big box, 2, and 3. And you can see that even before we started counting the 1, the R wave covered about 2 small boxes here. And look at the tip. It goes beyond about 1 small box It means that the R wave covers 3 big boxes plus 3 small boxes. And 3 big boxes is equal to 15 millimeters. And so adding everything, the R wave covers 18 millimeters. Now, adding the 18 to the 22, it means that the S wave in V1 plus the R wave in V5 is 40 millimeters. And since it's more than 35 millimeters, this ECG shows left ventricular hypertrophy. Good. Please do not forget to like and share our video, and also subscribe to our channel if you have not done that yet. So on this slide, I want to talk briefly about 2 other criteria. Just briefly, the criteria for left ventricular hypertrophy. And so the first is the Cornell voltage criteria. The criteria uses the S wave in lead V3 plus the R wave in lead AVL. When they are added, for male patients, it should not be more than 28 millimeters. If more than 28 millimeters, it indicates left ventricular hypertrophy. And for female patients, anything more than 20 millimeters would indicate left ventricular hypertrophy. Then the last criteria I want to talk briefly about is the Romhild-Estes point score system. Now, this is a score system which is made up of 6 criteria, each with allotted or allocated points. And the maximum score is 14 points. You can look or you can check this criteria online, but I want to say that a score of 5 or more gives a definitive diagnosis of left ventricular hypertrophy. And then a score of 4 gives a probable diagnosis of left ventricular hypertrophy. Anything less than that is not really significant. Great. So now let's look at how to identify right ventricular hypertrophy. We will use this ECG reading to illustrate right ventricular hypertrophy. Now, like the left ventricular hypertrophy, there are many methods to identify right ventricular hypertrophy, but a simple and a common method is to pay attention to the QRS complex in lead V1. As you know, usually in lead V1, the S wave is more than the R wave. It means in lead V1, the QRS complex is predominantly negative. If this changes, there is a problem. And so in right ventricular hypertrophy, the R wave becomes more than the S wave. So we have the reverse. And so the RS ratio is more than 1 in lead V1. And that indicates right ventricular hypertrophy. So if you want to know whether a patient has right ventricular hypertrophy, check the QRS complex in lead V1, and then do the R to S ratio. If it's more than 1, then we have right ventricular hypertrophy, I wanted to say. Now remember the normal R wave progression we spoke about in our previous video. Remember we said the R wave is supposed to progressively increase from V1 to V5. It means V5 should have the highest R wave and then V1 should have the lowest. But you can see that the R wave progression in this ECG reading is lost, in that the R wave in V1 and V2 are almost the same, so there is no progression. And look at the R wave in V3 and V4. The R wave in V3 even is higher than in V4, and so there is loss of normal R wave progression in the precordial leads, and that also speaks for right ventricular hypertrophy. Now, in the event that both ventricles have become hypertrophied, you will see a combination of the features we discussed. You see features of right ventricular hypertrophy evidenced by R to S ratio more than 1, and you see that the Sokolow-Lyon method or criteria would also be more than 35 millimeters. If you have that, then you can comfortably diagnose a biventricular hypertrophy. Thank you for watching, and then see you in our next video. Bye.